Yeah, and I think, that as I mentioned, the DOACs are really effective. So is warfarin. Like the major advantage of DOACs weren't they were more effective than warfarin. They were much safer with respect to intracranial hemorrhage predominantly. And my personal opinion is like I would love for these drugs to be as effective than DOACs. I don't know if I need them to be more effective. DOACs are incredibly effective. They're just not safe. And so I think what I envision factor 11 inhibition is that I hope they're as effective as the DOACs. If they're more effective, great. But the reason we're not using the DOACs is because they're not effective. It's because the bleeding is intolerable for many patients. So I think the unique advantage of factor 11 inhibition is that you could potentially be as effective in thrombosis as these other mechanisms, the DOAC or warfarin. But because of the way it acts in the blood clotting cascade, it doesn't interfere with normal hemostasis. And so I think the advantage is going to be similar efficacy would be great, but just vanishingly safe. And that's, I think, the major advance, because bleeding or the fear of bleeding drives the entire utilization of anticoagulation. It's not due to concerns about efficacy. Everyone believes they're incredibly effective. They're just like, it's too unsafe for my patient.